Dr. Stacey Cutbush and Samantha Charm will be presenting outcomes of human trafficking tool. It's an instrument is meant for a variety of different organizations that help a human trafficking survivor throughout their healing journey. And then we'll have a discussion panel from Elevate Collaborative, and they're based in LA. They have a variety of different programs using this tool. So we'll get a little bit of insight of what implementing the tool looks like. If you're joining us for the first time, this is HT Radar. It's short for Human Trafficking Research and Data Advisory Roundtable. It's much easier to just say HT Radar. We are based in San Diego, California. We are funded fully by the San Diego County DA's office. We are inside of the Human Trafficking CSEC Advisory Council. We are inside one of the subcommittees. There's a research and data subcommittee, and HT Radar is advised by them. So that's a little bit of context on HT Radar. So Stacey Cutbush and Samantha Charm are the lead researchers on this new innovative instrument. It's actually been around for, correct me if I'm wrong, but about 2 years now, isn't it? Okay, so we're going to get more insight on the tool and how it's been developed. It's gone through some validation and really has been very thoroughly validated, but it's still the first version. So we'll get some insight on that. The categories that are measured, some of them are, and this is broad categories, there's a lot of subcategories within them, are safety, well-being, rights, social connectedness, and self-sufficiency. Before I hand it off to the presenters, I do want to do a survey just to see where our audience is at knowledge-wise about the tool. So it should be popping up on your screen. First question is, how familiar are you with OHTS, which is short for Outcomes of Human Trafficking Survivors tool? All right. Okay, we're going to close the poll. You should see the responses in a second. Do you see that? I think this is going to be particularly helpful for our presenters as they navigate this. All right. Okay, and with that, I hand it off to Samantha Charm and Dr. Stacey Cutbush. I'm going to stop screen sharing.
Thank you so much, Liz. I know Sam's in the process of pulling up our presentation now. We are so excited about this consortium and just the incredible work that each of you here are doing to support survivors in their recovery. And to that end, I just want to start by acknowledging the survivors in the room. Supporting survivors' growth and healing and recovery over time is our North Star. It is what guides our work, and it lies at the heart of who we are and what we're here to talk about today. I also want to acknowledge other practitioners and researchers in the room. We just honor the work that everyone's doing and all the myriad ways we're coming together to do this important work. So I'm Stacey Cutbush Starseed, and I served as the principal investigator for the study that we're presenting on today, which is the study that yielded the Outcomes for Human Trafficking Survivors instrument. And Sam Charm, my esteemed colleague, was also a vital leader within that team that developed and tested the OHTS. So the two of us will be co-presenting today, and again, we're very honored to be here. So this work we're going to be describing today was funded by the National Institute of Justice. In this study, this project, we developed and tested a quantitative evaluation instrument designed to measure change over time on key outcomes among survivors of sex and labor trafficking. We will provide a brief demo of the instrument or the tool, and also discuss best practices involving implementation, following sort of some upfront content on the development and testing. But first, let's start by discussing the impetus for developing this tool and an overview of what the tool is intended to do. So let's begin by talking about why so few service programs measure outcomes. We know that providers face several challenges to outcome evaluation. First, we know that no single indicator represents success for survivors of trafficking, and instead we must measure a holistic constellation of outcomes needed for survivors to build and sustain a life beyond trafficking. So, and these were not yet articulated in the research literature when we started out on our project. We also know that case managers' focus is on providing services rather than using their time with their clients on evaluation or on asking survivors to complete surveys or participate in an evaluation of their own progress. But given these challenges, we have many evaluations of program services and outputs, but almost no data on survivor outcomes. And yet the field needs outcome evaluations both to inform program development and refinement, victim service provision, but also to document program impact. So how do we, our next question then was, well, how do we move forward? How do we start this progress? So our primary study purpose was to advance the development of evidence-informed services by creating and testing an evaluation instrument that's methodologically strong and relevant to program services and survivor experiences. So to do this, we tested and refined in several iterations an instrument to capture client progress in domains tied to key outcomes, and I'll talk about those outcomes momentarily. We used as our starting point an existing instrument from our colleagues at CAST, the Coalition Against Slavery and Trafficking in Los Angeles. They were enthusiastic collaborators, so we just always want to give them a huge shout out for the great work in the field they're doing. The instrument they had was designed to be completed by case managers based on observable indicators. So things that a case manager, they could interact with that client and be able to observe or discuss changes. The tool does not measure internal states of being, for example, like hope or empowerment. And I just also want to let's just pause here at the beginning of this conversation. I think it's important to state that it's sometimes uncomfortable to discuss people's lives, their lived experiences, particularly experiences involving trauma, as numbers. Again, though, as scientists living in an evidence-based funding climate, our goal is really to try to identify the best possible way we could to quantify survivor improvement over time, so that service providers like yourself can look internally at resource allocations and also be able to document program impact to funders. Moving forward, the intended purpose of the tool is multifold. So first and foremost, it's to support case management. So for example, for a service provider to be able to say, being able to identify my client's priorities and refer back to prior data points helped me provide more targeted service provision. That's one example. Another, to inform data-driven program development. So for example, our work seems to be more effective for this group of clients. How can we improve with other clients? It's for programs to be able to look at themselves. It's also to identify resource gaps. You might look at your data and say, wow, nearly half of our clients are really vulnerable in this particular outcome category. So can we identify partners in our community to support our service provision in this area, to build knowledge? So for example, adding fast access housing to our services improved client outcomes and several additional outcomes that we didn't even expect. And then also, as I mentioned, to communicate program successes to stakeholders and funders. So, maybe to be able to say, after 6 months of program participation, 2/3 of our clients had made progress towards most or all of their priority goals. So, again, the tool is designed to serve in several different capacities. And based on our awareness just of all these needs you see up on this slide, we set forth to develop this tool to support comprehensive service providers, or programs rather, for survivors of human trafficking. So the tool we developed, the OHTS, very short, documents the status of program participants or clients. We're sort of using that term interchangeably, over time in outcome categories related to 4 chief areas: safety, well-being, social connectedness, and self-sufficiency. More specifically, these are the categories that the tool measures and you'll see them broken out by boxes according to those categories, right? So we have safety, we have well-being, also rights, I don't think I mentioned that, social connectedness, self-sufficiency. So within each of these boxes, these are the different outcomes that OHTS targets. So you'll notice they cluster, right, around, we were calling them theoretical constructs, but in ways that made sense. So in addition to defining outcome categories, we made several instrument decisions based on what we learned through some preliminary activities. And I'll move into this actually on the next slide. Let's move forward just to talk about, now that you know the impetus for the tool, the development and testing of the tool. So at each step, our focus was on assessing and improving the instrument's validity. And that is the degree to which it accurately measures what it's intended to measure. Also, reliability, or the degree to which it measures consistently across items, across respondents. So that would be indication that the tool works well. So we implemented a three-stage approach to instrument development and testing. On this diagram here, I know it's a lot of content on here, and just basically the big picture message is that it was very iterative. So in our first stage, we focused on content validity, and that is once again really focusing on making sure the measures measure what we want them to. So we first looked at, we conducted environmental scans. We had expert panels, one with survivors, one with practitioners, one with researchers, and we extensively revised just that starting point instrument, that CAS that we started with from CAS. In our second stage, we assessed instrumentation by conducting a scoring exercise and cognitive interviews. If you don't know what that is, just hang with me, we'll get there. And we improved the instrument based on what we learned. And then at the end, we assessed reliability and concurrent validity by testing the instrument's performance when it was used by program directors and case managers. So I'm going to get in the weeds a little bit on each of these activities, but this is sort of a global overview of our testing process. Let's keep moving forward. So the first activity that I mentioned to you was assessing and improving content validity. In other words, do the measures or questions accurately assess what we want to know? So we wanted an instrument that reflected a holistic perspective on outcomes that I mentioned on a prior slide. And additionally, the instrument needed to be useful to diverse programs, right, including those that served adults and minors, domestic and foreign-born, and those who had experienced sex and or labor trafficking. We also wanted to capture outcomes relevant to the comprehensive service model for programs funded by the Office for Victims of Crime, through the Department of Justice, OVC, and then also through the Administration for Children and Families under HHS, or Health and Human Services. And finally, we wanted to capture the appropriate range of client situations they might find themselves in, from crisis on one end of the spectrum all the way to thriving on the other end of the spectrum. So this is clearly an ambitious undertaking. We reviewed every instrument we could identify. Again, we convened these separate expert panels of service providers, leading researchers in the areas, and survivor advocates. And after reconciling many diverse perspectives, we landed on that list of outcomes shown previously. From there, we went into our second stage, which we called the scoring. We were seeking to improve scoring. So following our environmental scan and expert panels, that's what we set out to do. Our goal was to assess the validity or the accuracy of the descriptions or response options that we wrote and assigned to our crisis to thriving scale. So for example, in housing, we developed a scale. 1 would be in crisis, if you will, and 5 would be thriving, and there are several points in between it. And we're gonna get into a demo where you'll get to see what this actually looks like. So we conducted this scoring exercise with 23 human trafficking program directors and case managers. We asked participants about how the instrument's descriptions of clients who are in crisis, who are stable, who are thriving conditions compared to their lived practice experience. We wanted to know if each of our descriptions assigned to each one of those anchors were too positive, too negative, or about right. And we did this for every category. We then made copious revisions based on their quantitative and qualitative feedback. There were open-ended response options for them to provide additional information to us. So we were very pleased by the results. And I will pause to say, I'm not going to get too in the weeds with the data findings. That is published elsewhere. I don't want to lose people here in this audience. But we can share that manuscript if you really want to get in the weeds with this data, the findings. But in general, they told us across all categories, on average, 85% of respondents said that the answers were about right compared to their lived practice experience as case managers. So, you know, we knew that we still had some work to do, though. We wanted to move that 85% needle closer to 100. So we incorporated all their feedback by revising the language. If they said it was too positive, we adjusted it to make it a little more realistic. And then in addition, as I mentioned, there were some open-ended feedback responses they could provide. And that was really helpful for us. People offered divergent suggestions about how to improve, but they did make some important suggestions and said, you know, I think you need to be a little more trauma-informed in the way you frame this, or I think these responses need to be a little more strength-based. So we really appreciated, they schooled us on that, and we took all of those revisions to heart and implemented them, applied them to our instrument, and conducted extensive revisions of our descriptions. And then from there, we went on to our next activity, which is called cognitive interviewing. For those of you who aren't familiar with what that means, basically, cognitive interviewing is designed to improve instrument clarity and navigability. So basically, when somebody opens up this instrument for the first time, a case manager, right? Does it make sense? Can they figure out where to go and what to do? Are the directions clear? You know, how are they interpreting the words? Or is everyone interpreting the words the same way? Or are we noticing some people interpret words differently? In which case, we need to reconcile that. So again, it's a type of interviewing focused on understanding how individuals mentally process and complete questionnaires or instruments. So again, the goal of the cognitive interviewing was to improve the instrument clarity and navigability in terms of instrument instructions, assessment items, and the overall layout of the instrument. We developed a protocol that asked case managers about general comprehension, technical terms, clarity of instructions. And then we recruited and conducted cognitive interviews with 9 case managers who provided comprehensive services to trafficking survivors. All interviews were conducted in Zoom, web conferencing using the screen share function. And, you know, it was interesting. Our cognitive interviews indicated, that case managers were comfortable with the language included in the tool and the different descriptors. Generally, when probed, they consistently interpreted different terms and phrases. However, the interviews indicated significant misunderstanding in how to logistically complete the tool. So having worked with the tool for a long time as we were developing it, some things that had seemed intuitive to us were not to them. And in certain places, you know, they were able to tell us which parts were more confusing, and we made revisions accordingly. Additionally and significantly, given this is a measurement tool, even when given the same instructions on how to score, respondents used very different approaches and factors to how they calculated the scores for their survivors. So meaning 2 people who selected all of the same, descriptions in the categories at the end arrived at different scores. So we realized we needed to do something about that. And we made significant changes based on that feedback to make the instrument itself more helpful, user-friendly for the user. For our final activity, we assessed something called reliability and concurrent validity. I've mentioned those terms a few times. By now, most fields, like for example, intimate partner violence, substance use, mental health, most fields have established by now a gold star instrument, one that's been validated. And human trafficking as a field, we're just not there yet. There isn't one, or there wasn't one until this tool. So we wanted to produce the most valid instrument in the field that we could, capable of producing the most accurate assessments. And so since we didn't have an existing gold star instrument to compare our instrument to, we had to come up with an innovative methodology and do some testing in a way that wouldn't burden survivors. So we developed qualitative case narratives or vignettes. We call them hypothetical client cases. These were derived from client case notes. So we constructed a total of 6 hypothetical client cases. We designed them on a few key factors, including whether the hypothetical client was, for example, US or foreign born, adult or minor, had experienced labor trafficking or sex trafficking or both. So we aim to represent clients who were diverse in terms of their statuses, not just on those markers, but also on, for example, the 14 outcome categories, so that they were having different experiences in terms of behavioral health or access and public benefits or safety, housing, to be able to really cover a full spectrum of scenarios, if you will. We then asked several practitioners in the field to review and provide feedback on the hypothetical client vignettes, and we incorporated their suggestions for revisions. And then finally, we asked 2 separate pools of respondents to use those hypothetical narratives, case vignettes, and use our instrument, complete our instrument using what was written down on paper. And one group we called our our experts, our gold star experts, if you will, were our very seasoned leaders in the field, program directors of very established human trafficking programs nationwide. And our second pool of respondents was case managers. So we had each group complete the instrument on all 6 of the vignettes, and then we compared their responses. We were overall really pleased with the findings for our program director group. 12 out of the 14 dimensions demonstrated excellent reliability, while 2 of the dimensions produced reliability scores in the good range. And then again, we did that same activity for our case managers to see how consistently they scored. Their scores were still very strong, above average, but a little lower than our experts, which made sense to us, given that some of our case managers maybe didn't have as much experience. In any event, we were able to look at which outcomes were performing the best, which ones may need some more attention or training on for people who choose to administer this tool. So for example, the dimension with the greatest internal discrepancy was the physical health, which suggests that there may need to be, that was the one that was performing really well. And, it made sense to us, given the variability that we could see in different survivors' experiences. I feel like I'm getting a little bit in the weeds. I'm going to stop myself. And again, we can drop a link in the chat to the manuscript, and you can always reach out if you really want to learn more about some of the really specific data findings. Overall, though, what we learned is that the tool is functioning really well. Certainly, we feel confident it's the most robust tool that exists in the field measuring outcomes for survivors. And from there, I do want to state, I think with any research study, there are limitations in it. I think specifically, we really didn't want to burden survivors by asking them to have to complete this tool or participate in too many research activities. At the same time, they did inform particularly the groundwork about what types of outcome categories and how to measure them. But I do think that, the next step to improve this tool is to be able to validate it with a much larger sample and a real sample, if you will, rather than a hypothetical sample. That said, we're excited about what we've pulled together and hope it can be of some utility to service providers in the field. We've gotten really great feedback so far, and we're excited to share it with you today. It is, I'll just first say up front, it's freely available for download on our website, and we'll be sure to drop that link in the chat for you. So in the meantime, I'm going to turn this over to Sam Charm, who will be able to provide for you a instrument demonstration so that you can gain some familiarity with what it looks like, how it works, what some of the key features are. And then from there, we'll talk about some implementation best practices and how it might have utility at your organization if, for example, you are a case manager or a program director. Sam?
Hi, everyone. I'm excited to show you our instrument. I know Stacey's been talking about it theoretically for a while, and it can be hard to picture. So let's walk through it a little bit together. The instrument that we developed has 4 primary functions. One is to input the assessment data using the tool that we developed. 2 is to review or edit records that have been entered previously. 3 is to store the data from each time the tool is completed. And 4, it does some summarizing of the data for you. So hang on one second while I'm just going to pull up the instrument for us to take a look at together. Can everybody see the instrument? Give me a thumbs up.
Yes.
Awesome. So the instrument has these different functions that I just described across these colored tabs along the bottom of this Excel here. And I will note this is in an Excel file format, and the current iteration can only be used in an environment with Excel for PC or for Windows. It does not currently have all its capabilities in Excel for Mac, or iOS. So just wanted to put that out there. So each of these functions is along the colored tabs at the bottom, and they have an instruction tab telling you how to use it, followed by the tab with the function itself. So let's walk through how you would input a client record. So the first thing that you're going to do is enter a client ID, and this field does not have any required format, and that we hope will allow you to be consistent with whatever client ID system that your organization uses. This might facilitate combining this data with any other data that you capture about clients or programming. So for now, I'm just going to use 1 as my client ID. Please note, for data security purposes, we recommend that you not use names or any identifying information in this document. And then you'll answer the date the assessment is completed. So I'm just going to enter today's date. And the next thing you'll do is move down to our outcome category rows. Now, these are the categories that Stacey was describing previously. And we're going to start here with behavioral health. The first thing that I'm going to do is read this definition that's provided here on the left hand in this left-hand column. And I'm also going to note here there's a client priority goal checkbox. If the behavioral health area is something that the client has noted as a priority for them, I'm going to check that box because this tool allows you to separate out the things that the client has identified as something they really want to work on, because we recognize that everybody's goals are different for themselves and they may not want to or be able to work on every single one of these categories at once. Let me see if I can everybody read this Excel, or is it a little bit too small at this time? Let me see if I can make this bigger for you. Hang on one second.
That's actually better right there. I think it's bigger now, at least from my screen.
Is that better?
Yep, that's great.
Okay, fabulous. All right. So once I have read the definition and identified whether this is a goal for my client, I'm going to read across each row and check the box of the description that best describes my client at this point in time. And I'm going to do that for each row within that category. If I did not have enough information to complete a row for a client, because you may not have all of the information needed, I would check this intentionally skipped box. But once I have completed both rows, the summary score is going to automatically populate here on the left. And I won't make you do all of these categories with me right now, But as you scroll down, there are the 14 categories that Stacey described going down this sheet. And once you've completed all of them, you'll click this Add Status Record button here on the top right. You can see that it will tell you if you are missing data in the instrument, and it will mark that in each category and up here at the top. So once you have clicked Add Status Record, the data is going to populate here on this Client Status Data tab. That is where all the raw data is saved once you've entered it. The other thing I just want to show you, this screen, this blue screen, blue tab is where you can select a record to view or to edit. So when you select it initially, it's going to pull up all of the client's data for the date that you select. And if you want to edit the record, you'll select Edit Record and you can make changes here and resave it. That way, you don't have to go into raw data and try to figure out how to change it from there. If for some reason you made an error, or if for some reason a record needed to be deleted, you could do that from here as well. So, as I mentioned, anytime you save a new assessment or you make changes, that data is going to save here on this Client Status Data tab. And each row here is one time that the instrument was completed. So the data that's here can be copied and pasted into a new Excel spreadsheet to do any other kind of data analysis. You cannot edit it right in here to avoid any error, but if you want to copy and paste it, because Excel is one of the most common data formats and a lot of analysis software and client databases are compatible with this type of file, we hope that having the data in this format will help make it possible to integrate the data from this tool in with your existing systems and facilitate any further analysis that you want to do. However, we recognize because programs have different levels of data analysis resources, the tool does some summary analysis on its own. And that's what happens here on these green tabs. So the first one I'm going to show you is the client single assessment summary. So this just shows you graphically the results for one client at a specific date. And this box here shows you the average rating across all categories, and then the categories that the client specifically identified as their priority categories. And so this summary might assist you in identifying areas where the client is doing really well or where they might be experiencing challenges. This table on the bottom left shows you the summary score for each of the different 14 categories, with a star identifying the things that the client noted was a priority for them. On the right, we have this just visually graphed with the orange bars showing you what the client identified as their priorities. Next, we're going to look at change over time. So let me just see here. This can show you up to 10 different data points for a given client, and it will plot this change over time for you to look at progress. It will show you the scores for each individual for each individual category for each time point at which they were assessed. And then we'll graph that over time where you can see progress. And I think we all recognize that progress is not linear. And so it might show you ups and downs over time as well. Lastly, I want to take a look at the program level summary, which shows you the average summary rating across clients by outcome category. So this would show you summary data on the most recent assessment for all clients that have an assessment during the dates of input that you choose. So this is between January of 2019 and January of 2020. And this box is going to show you how many clients fit into that range and their average rating across all of the outcome categories. And then we're just going to break this down by each of the different outcome categories individually. And this table on the right then just shows you the average summary rating visualized. And what this can do is give you a snapshot of the needs of your group of clients. And it might identify areas where additional resources or program supports might be needed. Additionally, it might be able to help you see shifts in the needs for your client population at different points in time. For example, you could, if you had the data, you could look how your client population's needs have shifted from before, during, and now in the COVID-19 pandemic, for example. And so again, given the diversity of service programs for survivors, our approach has been to try to make this tool flexible enough to meet your program needs rather than prescribe a specific evaluation process. So I'm going to pass this back to Stacey at this point in time to talk a little bit about some of the best practices and flexibilities with this tool. So hang on.
Thank you, Sam.
1 second,
Yep.
and I will get the PowerPoint back up.
Oh, you got it. Thank you. So I think, just to sort of summarize and highlight some of the things that we're excited about, the functionality of the tool is one that it is programmed in Excel, at least in Windows for now. And we also know that we've been responsive to case managers' needs or requests to make this something where they can track progress over time in ways that are really able to capture baby steps. And I'm not saying that in a pejorative sense, it's just we wanted to make sure that this instrument would be sensitive enough to really capture the small movements that happen, over months and over time. So we're excited about this, and it just also its capabilities so that the data can be exported and merged. So I really appreciate you doing that demo, Sam. We want to turn briefly just to some implementation guidance and best practices. We know we have a lot of service providers here in the room today. And so when thinking about how to prepare to use the OHTS, I think there are a few things to keep in mind. Of course, we fundamentally just respect that you will need to use this tool based on your own organization's needs, based on your own goals. We, naturally, as Sam mentioned, this only functions in Windows for now. We do hope to obtain funding in the future to build it out. In an iOS environment, but for now, we originally set forth really just to develop a paper and pencil survey, but we're able to carry it a step further and program it in Excel for Windows. So just making sure you have the right operating platform. And then I think it's important to train staff on the OHTS to sit down as a team and really review the instrument instructions and make sure that folks are defining terms, for example, like behavioral health. That can mean something very different to everybody, and that's why we included a definition to support programs and case managers making sure they're conceptualizing it the same way. But I think coming together as a team to really review those instructions, review the definitions and guidelines for key terms and outcome categories is going to be really critical to just ensuring the success of the implementation at your organization. When it's time to move into implementation, a couple of key points just for us to reiterate that this is not to be completed in the presence of a client. This is designed to be completed by case managers following an interaction with a client at whatever cadence makes the most sense for your organization. We get the question very often, like, well, how frequently should we administer? And once again, we will always defer to your program's needs. I think that question really depends on the frequency of touches, the duration of touches, right? And I'm getting at intensity of services, right? Is this a drop-in center where just somebody is periodically coming in, or is there constant, or frequent communication and contact? We tend to think that administering, in terms of frequency, administering quarterly would make sense, because that would allow the survivor to really make some progress and gain some traction on those client priority goals in particular. That said, we recognize that some programs may just, for example, we've worked with some housing organizations that only keep clients for example, 8 weeks. So it's really, once again, dependent upon your context, your setting, your organization's needs. We do recommend, where possible, administering this tool for the first time as close to your first encounter with that client as possible. It may not be appropriate, right? If this client is coming to you in crisis, to systematically walk through all of these categories, right? But that's why we've designed the tool the way that we have, so that any case manager, say you only get to talk about like safety and housing, like immediately in that first interaction, there's a way that you can code that, you can record that information from that first interaction, and then maybe in your subsequent interaction with this client, you're able to get to some other categories, maybe like employment or education. And so that's why we've, programmed this tool to have ways to say, I don't know, or intentionally skipped. So that the whole program won't kind of blow up or implode. You'll still be able to calculate some scores on some of those key outcome variables and track those from the very beginning. But once again, we will always respectfully defer to service organizations. You know best about when to first administer this tool or first complete this tool on a client. I think the thing we just want to gently point out, and it probably makes sense to you already, right? If you wait until 3 months, for example, after that first intake of the client, and the client's already making progress, then you're not going to see, like, say maybe if they're scoring a 1, and then by 3 months later they get to a 2, eventually they get to a 3. If you don't start from the beginning, you're not going to be able to show those tremendous gains that the program impacts. And then similarly, well, I just think just that, right? It's going to show maybe your program isn't having as much impact, when in fact, no, it is. It's just that we didn't get that baseline measure. So it's just something to think about and talk about as an organization, I think, internally, what works best for you. We get questions also like, how long does this take to complete? The feedback we're getting from the field is the first time about an hour. And then once you are very familiar, like just you have familiarity with this instrument, you're like, oh, I get it. Now I see how this works. It's taking about 20 minutes to complete after a client interaction. Moving on to data security and participant confidentiality. This is something we take very seriously, as I'm sure all of you do also. We have several suggestions to really ensure that your client's data is secure, right? That the data can't be breached. Even that if the data was to be subpoenaed, that your client is still protected. So there are a few things here. One practice we have internally at our organization is to sign confidentiality pledges and secure those to ensure that everybody adheres to a set of standards and agreements involving a participant's confidentiality. We also recommend, and Sam talked about this, never using a person's name, a client's name in this instrument. Always create an ID number for them. If your organization uses that anyways, you can link those up, right, with a key, whereby you have, for example, stored somewhere else a password protected Excel file that has the client's name and their like 001 is this person's ID, next person 002, so that you can unlock that information at a later time if you need to, but that it's not all stored in the same file in the same location. So again, that's about keeping the key and the OHTS data password protected. If you need guidance on how to password protect Excel files, shoot us an email. We've pulled together really simple instructions for that. I say simple, I just know that there's a lot you're doing already, so we're happy to help you with that. We also recommend storing the data on a secure network. Hopefully you've got a firewall or a VPN at your organization. That might be something to look into. And again, just back up your data. We don't recommend keeping it on a hard drive, right? What if that laptop disappears? That's a sort of a liability in terms of a data breach. So just be thinking very carefully about these things. I encourage you to, from there, how to use your data. Again, and I spoke to this a little bit at the beginning of our conversation, well, presentation. We're getting to the conversation. Again, first and foremost, it's to improve client case management, right? It's to be able to look at over time and not just have to keep it in your head or go through all these case records. Like, how is this person doing, right? Is we moving forward in some areas, or maybe moving backwards in others? Where do we need to shore up additional support, service provision? So that's really to support your own case management. But then at a larger program level, it's designed to support program improvement so that you can look across clients and say, gosh, we're knocking it out of the park in these areas, but we really need some more resource allocation around, let's say, parenting, or we need to be partnering with another agency or organization who can help provide those services for our clients. So it looks like they need help in this area. And then importantly, too, to demonstrate program impact to funders, to say, here's where, thank you for funding us. Look at the impact it's making. We're changing people's lives. We know that you're changing people's lives, right? This is really just an opportunity for you to quantify that and demonstrate that impact. So, that's sort of a quick overview. I will say that a lot of the information I just shared can be found in a free guide we developed. It's called the OHTS User Guide. That can also be downloaded in our website. I'm getting ready to drop a few links in the chat for you right now. So this user guide, we knew that our grant would be sunsetting. We would not be able to provide training and technical assistance to everyone who needs it. We get emails every month, like, can you help us? Can you train us? And unfortunately, no, we're trying to secure additional funding for that right now. We can't. So we tried to anticipate as many questions as we could and put that information into what we're calling our user guide. I'm dropping links now. Oh, it's not hyperlinking.
I put it in right above your comment is the user guide link.
Oh, hey, thanks. I appreciate that, Liz. Could you please also put the development guide? That was the other one I wanted to mention. So the user guide is in there. It's an interactive PDF, so you can find some of the information that you need quickly to facilitate your preparation and implementation. And then beyond that, we developed what we're calling a development brief. So we recognize there's a really diverse audience here today. If you want to learn more about the development and testing and just plain speak, really short, simple, easy to understand, I would encourage you to track down that development brief. It kind of goes through and documents a lot of what we talked about here today in lay terms. If you sort of geek out on the scientific stuff and you want to go find a peer-reviewed manuscript to really get in the weeds with the data findings, then that exists as well. I think you can move forward, please, Sam. So that's just sort of a snapshot of the development brief. Hopefully Liz can drop that in as well. If you want to contact either one of us, please feel free to do so, just with the caveat that we are unfortunately a little bit hamstrung in our ability to provide intensive training and technical assistance. But if you have a quick question, we don't mind asking that. So from here, I think we're ready to open it back up and invite our panel members into the conversation, field any questions that you may have. Just want to say thank you for your patience. I know it's a lot of content to get through.
Thank you, Stacey and Sam. That is a lot of information, but it's a lot of great information. Since, of course, I am with an HT Radar, I geek out at how exciting the outcomes are and how influential they can be. I hope everybody sees the importance and the relevance of this across the field. Really, people, government, money is moved by numbers. So being able to show how beneficial your program is will drive a lot of policy and will also drive a lot of funding towards our organizations, which I know all of them need it. And aside from the numbers and the policy and everything like that, it will also show internally, like, how can we improve? What is working? What's not working? And we can individually just look for outcomes within our organizations, but if we're able to compare across organizations and see which strategies are working better, it really is going to push the movement forward a lot faster and a lot more strategically. So this is why I was so excited to bring you guys onto HT Radar, and I'm so glad that you guys are letting us record this. I think it's going to have a ripple effect. So right now I do want to take a pause. We do have panelists who will be talking a little bit more about the logistics of implementing it. But I want to address a couple of questions about the tool itself, and then we will also be doing more of a discussion on the logistics of having it implemented later on. And in between, there will be a 5-minute break. I know that this is a lot of dense information, but right now I did see a couple of really great questions in the chat, so I'll ask them. So Sarah Johnson asked, is there a potential conversation within OVC, HHS, and Cal OES to include these within their data tracking systems? She said, I have heard that it's difficult for managers, case managers, and program managers to translate this data into the reports in order to show the outcomes and impacts to their funders. That's the first part of the question. The second part is, also, since the tool is not being used in the presence of clients, since it's so long, is there a cheat sheet of the topics and categories to cover the newer staff and users when in the presence of the clients without filling out the full tool?
Okay, these are really, really outstanding questions. And so I would just invite, at this point, folks just jump in, Sam, panel members. I can tell you that I had many conversations with OVC about this tool. I've presented to their OVC Human Trafficking Division. I think there's a lot of enthusiasm and interest for it, and clearly they're wanting to get the rest of the field to outcomes. But as a federal agency, they are really remiss to make any grantees use any one tool. So this goes for identification tools, screening tools, assessment tools, and also outcome measurement tools. And so I think they're very interested in supporting the use of it in the absence of anything more rigorously tested at this point, but are really reticent to sort of mandate that. Same with HHS, although I've had, most of my work is funded by OVC and NIJ, so out of the Department of Justice rather than HHS. I do know they're aware of the tool and enthusiastic about it as well.
In on that before we move on, I'm so sorry.
Yeah.
So I would just say that again, our goal is also to figure out, and unfortunately, the way we're funded has limitations on what we can do. I think we recognize that while the instrument does some summary data, it does not do all the analysis that to get the data that people are hoping for to get to what can really be easily abstracted to outcomes for funders. I think that's some place we hope to go in the future, and be able to set up some additional support or coding or different ways, but we haven't had the opportunity to do that yet. But we do recognize that as a challenge that folks are facing, and unfortunately don't have anything for that yet. I will also say at the end of the user guide is a set of sort of just the outcome category lists and some key definitions, which I think could be printed as to help just as sort of a guide of trying to help people remember what the categories are that are going to be on it, as that could be used as part of case management. That doesn't tell you every single description across the category, across the spectrum, but it might just be something that you could print easily, because that Excel does not print easily, let me tell you, and just to have that as a small reference, but we don't have anything else at this point as like a cheat sheet in that way.
Thanks, Sam. Yeah, I just threw it up here again. This isn't the user guide. This is the interactive guide that I mentioned. And so if you can very easily find that. This is, when I say interactive, you can toggle across it. The definitions are over here. So these are all of the outcome categories, all 14 of them. And we provide really specific definitions. For example, safety includes threats to physical, emotional, financial safety and freedom. That can come from any source, including a trafficker. So, you know, this is just one example, but it can help get folks on the same page. And again, that's one of the reasons why we really just strongly encourage the organizations to get together and start to get on the same page about that. How do I stop sharing my screen? In any event, please continue moving forward with questions.
All right. And just letting everybody know that most likely we won't get through all the questions now, but typically what we do is record those questions and send them over to the panelists and the presenters, and the responses will be included in an email and also on our follow-up recap page. So if we don't get to you, still put them in the chat. It's okay. We will eventually. It might take about a week, but we'll get your answers. So continuing on the question that Brian Cullison added in here, is there a plan to adapt the tool to a web portal version or an app to be more universal and cloud-based?
Not at this time. I love the idea, Brian. I think that's really great. At this point, I think our next immediate priority is to program it in iOS. I get a little bit nervous about cloud-based data through phones, data collection through phones, but or other sort of tablets, unless it's happening behind a VPN. But I do think that there are successful models out there that we could look at, and I'd love to talk more with you about the idea.
All right. We'll sneak in 2 more questions and then do a little break so that everybody can stretch. And so Dr. Carly asked, was the reliability tested throughout different time frames?
No, it was one time. It was just using this hypothetical case vignette. So we're interested and eager for a larger, a larger study that really explores the validity and reliability in a much larger real sample, if you will. But our goal was really just to develop the tool, and then I think we're going to need subsequent funding to be able to continue testing, and particularly testing in different settings with subpopulations. Okay,
great. This question wasn't in the chat, but I want to ask it. What are you guys currently working on? Because it sounds like you guys are hitting the nose on all of these topics, and I'm excited to hear about future projects.
I'd be happy to talk about one of mine, and then Sam, I can let you talk about our OVC funded if you want to talk about our TTA work. I mean, it's slightly afield from, not really, but from this. I'm leading right now an NIJ funded study that looks at crossover use. So specifically, we're looking at youth and minor victims of trafficking who touch both the child welfare system and the juvenile justice system, to learn not only demographic characteristics involving system involvement, but just system involvement experiences themselves. And specifically, I'm talking about youth and minor victims, right, who have a human trafficking allegation, whether it is substantiated or not. We're interested in just learning as much as we can about youth with a human trafficking allegation that touch those systems. And then Sam and I also lead a OVC-funded human trafficking training and technical assistance project. You want to share about that, Sam?
Sure. So we provide training and technical assistance to grantees within the Improving Outcomes for Minor and Youth Victims of Trafficking program, which is state-level initiatives to support youth and minors who've experienced trafficking. So it's really system level change to try to better create a coordinated cross-agency support system for identifying and serving those youth. And we help support those state level grantees.
That's Kathy Torres. She's a rock star on our end. All right, great. Well, I do want to take a little bit of a break. If you guys are sitting at your desk and no one's watching and your camera is off, you can do a little dance just do a little stretch because what's coming is really interesting because we've listened to the theory and like the development of the tool, but really knowing how it's implemented and the effects that it has in different organizations is also a very important thing, especially if you're thinking about adopting the tool. So I'm gonna do 3 minutes. I think 5 minutes, we might lose people. So let's do 3 minutes and we'll be right back. Perfect. All right. So we are now going to listen from Los Angeles-based Elevate Ministries. They are a collaborative that has implemented OHTS, and it is a diverse collaborative of different organizations that focus on different specialties within the healing journey of human trafficking survivors. I'm actually going to let you all introduce yourselves and just how you are engaged in both the human trafficking movement and also what role you play within the collaborative. Let's start in order with Esther, then Brian and Jamie.
Hi, everyone. My name is Esther Kwan, and I'm co-founder of Qualified, and I'm also the Chief Innovation Officer. And basically, I oversee all the programming, and my background is in occupational therapy. And so all of our programming has occupational therapy embedded into our programming. And so that means it's very holistic, and we don't just look at the technical job training for our survivors, but we really offer wellness support and a lot of other support that surrounds their self-sufficiency goals and for them to thrive and integrate into community.
Hi, everyone. My name is Brian. I work for Kingdom Causes, Inc. We are a nonprofit faith-based organization that focuses on a lot of different complex social issues, but the ones that we've been most active in for at least the last 10 or 11 years has been homelessness and human trafficking. I personally have been involved on the ground, street level, with volunteering with an anti-HT agency in South LA and Southern California, excuse me. But also as part of my work with Kingdom Causes, we wanted to basically through funding from a foundation, we wanted to provide a venue where we could basically put together a collaborative of 4 different agencies that were doing work in this area in Southern California, similar to each other, and complementary, but also not necessarily overlapping so much. And so as part of our work in that collaborative, Esther actually introduced us to the OHTS tool, and we've had this as our signature project to kind of get this up and running within our, not only the 4 organizations in the collaborative, but also in a broader sense. We really want to champion this on a national level.
Hi there, I'm Jamie Flick. I'm sort of unique in the bunch in that I'm not in LA or California. I'm Washington based and I work in academia, but I am an occupational therapist by training. So I became involved because the Elevate Ministries and the whole group really wanted to explore this tool and how it could be implemented. And I brought in a little bit of sort of that research focus or education focus so that we could build capacity to make this work. And I think that's my role here.
All right. Well, thank you very much for joining us. I actually, as I was trying to, a little background, as I was trying to get in contact with RTI, Brian reached out to me and he was saying like, hey, have you heard about this tool? I think it would be great for HT Radar. And I was like, yes, please. I've been trying to get in contact with the researchers. So thankfully he was able to connect us and be able to make this happen. So thank you all for joining. I would like to hear a little bit about how you got this collaborative started and when that happened, and how long you've been using it. So you guys know who is best suited to answer this question.
That's probably a me question. So we did, as I mentioned, we got a little bit of money from a foundation back in 2000. Actually, it was right at the end of 2020, but it was for implementing in 2021. And the idea was to bring together 4 anti-human trafficking agencies in Southern California, see what you can do to help coach, facilitate, provide funding, and even just collaborate in a creative way. So we've done that in a variety of ways so far, a lot with around the Super Bowl efforts. But then this OHTS tool came across our path after the first year, where we had already done some like applying for grants. And then the OHTS tool came across our path. We wanted to implement it on a bigger level. So we've been working with Dr. Flick, or Jamie. I know she's going to correct me, so I'll just say Jamie, and Esther, and seeing how we could get all 4 of our agencies working together on this. And we continue to have other projects in mind that we're collaborating on as well on a regular basis. So we'll see where that goes. But now it's been 2 years running, and we're going to continue it on at least through 2023 in one format or another.
All right, great. So I think the most pressing question for me, at least, is do you guys share clients? And if so, how do you maintain HIPAA compliance across organizations? We know that the tool itself, they recommend not using the names. They actually say don't use the names, use a number. But how do you get around all of that logistics as a collaborative?
Jamie, you want to take that, or should I take that?
I think we can sort of both take that. I will say from the identifier standpoint, when we were trying to set up what would work for each organization, that they're using the abbreviation of their organization, like qualify would be Q, in front of their patient identifier. So that's one way that we know that that information is attached to a certain organization, even though it could be a shared client. And then Esther, I'll let you take it from there.
Yeah, so just to give you guys a little background, for our organization Qualified, we've been using it for about 1.5 years now, pretty much since the beginning almost. And we now have about 4 sets of data, because we do use it every quarter for each of our academy graduates. And so we had that data, and we introduced it to the rest of the collaborative. And so the rest of the collaborative, they've started using it around about September. So it's really extremely new for everybody else. And so right now it's just in a phase of where everyone is really trying to get used to it, really, trying to figure out the tool and, really establish the assessments there. So we haven't exchanged or exported any data yet to the researchers. We've definitely just kept it in our files. We've protected it in the ways that Stacey mentioned in her presentation. Just make sure that that is password protected, keeping your laptops, even that password protected if we leave, shutting off the computer or logging off, all those things. And so, at this point, it hasn't been shared across organizations as of yet. That's just where we're at, but soon we would be able to, and we will try to do our best to do all the firewalls and, all the things in place that we need to do to make sure it's secure and there's no breach, in the data. Yeah.
Would it be helpful to back up a little bit and and share the journey just from those retreats, when people are just even deciding, will we accept this tool? There's the buy-in phase to, okay, now we have buy-in, now we try to do training. Esther, do you want to maybe give that background? Because I think that would be a helpful context as we're answering questions.
Sure, yeah. And Brian, you can pop in too. So the Elevate Collaborative, we started this about 2 years ago. Was that, Brian, right? And we were, as 4 organizations, we came together just to explore what kind of project that we would be doing as a team. And so the OHTS tool came up at the top, and we all decided to really go for this, just to see how we can, find outcomes for all of our organizations, because that's a very important topic for any anti-trafficking organization. And so we decided that's what we wanted to do. And so we started with a retreat. And it was, we didn't have the formal training. However, just with, myself and Jamie, we were really able to just, read all the development brief and all the resources available to us, and really try to put together a mini training for the rest of the collaborative. And I've been using it in our organization for the longest. And so, I was really pulling from my own experience and how I've been using it and how we've been using it as a team in our organization. And so we presented it to the other organizations. And, we also did a little vignette, just to practice, because like Stacey said, there was, no other, rubric or anything to measure it against. And so I decided to just put a case study together with a real person, a real survivor, and pull that data together. And we practiced all 4 organizations, and we tried to see within, that time, okay, are we all answering it correctly? Are we all, coming to a consensus? And at the beginning, people started realizing, oh, wait, I guess I rate things more positively than I should, and so it was a really neat exercise, because by the end of it, after, I think we went through all 14 categories. It took a while, but towards, the middle and end, we felt like there was some good consensus, and we felt like, okay, yeah, we think we could really agree and, on the answers. And of course, there were discrepancies here and there, but for the most part, we felt like we were able to be consistent. And so that's how it kind of started. And afterwards, all of the organizations really felt like it was such a valuable tool. Everyone was really excited because we saw the potential of what this could do as, just for our own needs, right? We can really assess, where are we doing well as an organization? Are we really hitting our goals as, whatever our mission is? Or, are there some gaps where we're like, ooh, we should be good at this, but you know what, we're not there yet. So kind of really giving us some ideas of what to target as well. And also the exciting part too, is that we can actually say, hey, our organization, we are making impact in these specific areas. And now we have numbers to back it up. And, it's great to have narratives. It's great to have stories, testimonials of our survivors who are saying, oh, Qualified changed my life, or Treasures changed my life, or Cherish, or FCI changed my life, all the organizations that are involved. And we know that we are having impact, but, again, with grants and different organizations that really look at, like funders, they really want to know with numbers, hey, is it really making a difference? And now, we're excited because we have something to start with and be able to show.
That's good, Esther. You took the words out of my mouth. I was going to say that that's one of the things we bring to the table with our experience as Kingdom Causes, but also our homeless services affiliate, CityNet, and data is driving everything. And for sure, it is a requirement for all of the grant writing and the RFPs that we're applying for. And so we wanted to bring that to the table for the HT organizations and say, hey, we need to start being able to figure out how we can have metrics, like you were saying. There's a dearth of tools in that region, in that area, or issue. So to have something like this is gold for us, and we want to be able to utilize it not only within the collaborative, but really it starts having even more impact more broadly it's used. It's like the network effect. It becomes more valuable the more people that use it, and we can have kind of a standard of measurement that everyone is basing their data off of and their outcomes. So that's why we wanted to do this, and we want to find out more agencies and organizations and states that are implementing this, so that we can support that. Maybe help with providing more and more like certified trainers, so that everything is not on Stacey and Samantha's shoulders. So yeah.
Thank you. And yes, anything, did you want to say something, Jamie?
I thought it might also be helpful because there's 4 organizations. Does the group know sort of what those 4 organizations do and how the clients sort of intersect with each other, if they do intersect? Because that would be important to understanding, looking at that data as it's coming in from the tool. So that might also be helpful.
Yeah, I can speak to that as well. We went through a vetting process where we were trying to figure out, because there's actually a lot of amazing organizations in Southern California, so it's hard to whittle down to 4. So we Just for the purpose of this collaborative, because we were a faith-based organization, we wanted to choose faith-based agencies to work with. And so we had a rubric of a test that we went through to kind of figure out kind of what would make the most sense. Like I kind of mentioned before, we want them to be complementary, but not like totally duplicative. Like they wanted there to be some kind of interaction where there would be like a symbiotic relationship with the clients that they had, and even just where they're not overly competitive. So basically what we ended up going with was somewhat geography and a little bit of like where they're at on working with survivors on their journey of development and health. So I think Esther mentioned it, but Cherished, Qualified, Treasures, and Forgotten Children, Inc., or FCI, are the 4 agencies that we ended up working with. And they are mostly LA based, but also extend down into Orange County, extend all the way up into San Bernardino, and like if you know the SoCal area, like the desert, Lancaster, Palmdale area. And they go anywhere from working with right on the streets from women on the tracks who are being trafficked, mostly in South LA, and also in strip clubs and in other what you might imagine, like brothels, massage parlors, etc. Things where areas where women might be trafficked, and also all the way through to not just like interaction right on the street, but through like where Qualified works with them after they've already been out and are in a more of a developmental phase where they're actually getting occupational therapy and other kind of mentoring. And so kind of the whole gamut geographically and on the progression of right at the beginning to more starting their healing journey already out of the game or the life. So we're happy to also share that if anyone wants to know kind of what that vetting process was and kind of the rubrics that we used. I won't bore you with those details, but do have those tools available.
That would be great. Let's try to include them on the recap and the follow-up email. I'll be sure to make note of that and request it. All right. And yeah, I know, Esther, you've been the one who's been working with it the longest. And I know that you had some really good insights on the training, and just want to know, like, what was the biggest difference between your organization using it and then collaborating with other organizations for you?
Yeah, since it's such a early phase right now with the collaboration, especially with the tool, because they just started implementing it in September. We only had data for the initial for all the organizations, and some of them are starting to do the reassessment. So it's kind of hard to, really compare, I guess, the data, and so pretty much I have the full sets of data, the pre-test and the post-test for our organization. So I could talk a little bit more about that, but in terms of, just my own experience with our own organization using it and all the other collaborative organizations, we don't really have as much, comparison right now. Hopefully in the future, we'll be able to share more of that, because that would be interesting, right, to see if there are differences or, just what we can find from that.
We probably have a little bit, though, given we started doing individual follow-ups with groups. We try to do it sort of as a big group setting, bringing everyone together, but logistically that's so hard because everyone's maxed out, have a lot of demands on their time. So we started reaching out to different organizations just to get their initial impression. Like, what are some of the barriers? What are some of your supports? How does this feel when you're implementing it? So, based on that, Esther, do you feel like there are differences between you and, let's say, our follow-up with like Treasures? That was our most recent follow-up.
Okay, yeah, if you talk about that kind of comparison. So
yeah,
our organization, so I'm an occupational therapist, and so I have a clinical lens. And so for me, using this tools was very intuitive. I got the language. It was very easy for me to kind of figure it out. And okay, I know exactly what, I'm not exactly, but you know what I mean? It's like I'm used to assessments and evaluations and looking at these details. And so, when we were really touching base with other organizations, not everyone has a clinical background, right? They're case managers or, different staff members who are assessing using this tool. And so from an organization, we realized that some of the language was a little bit, maybe technical for them, and they wanted more of a cheat sheet as well, so it kind of ranged. There were people who it was more intuitive to people who, this wasn't really their background, so they were kind of like had a lot of questions, within the categories, just teasing out maybe like behavioral and physical health categories, because they can really overlap. For example, insomnia, that is a physical issue, but it could be also a behavioral issue, right? Depending on, is it a chemical imbalance in your brain, or is it because of, their behaviors, they're sleeping late because they're, doing other activities that's, impeding their sleep. And so, these were just a lot of things that came up, a lot of different issues that came up. And we, as a collaborative, really tried to come to a consensus on what we feel like is the, thing that we should land on. And we did also, consult with Stacey as well, just to see if what we decided that was a consensus was, approved by her as well.
I am muted. So Esther, you had mentioned that your organization has the most information and you've gotten several data sets. What have you been able to do with that information internally or externally? Like, just let us know, what's it like 1 year later?
Right now, everything is pretty much internal. I haven't done the formal, analysis and summary and all that stuff, but I did take a look at all the data sets. And so we have about, 4 different cohorts that we have the data for, and each of the cohorts it's a 3-month program. So our program is a career development program, and we have occupational therapy integrated into it. And so our pre-test would be, that first month. And then when they graduate our program, we reassess again. And so it kind of falls in line with Stacey's recommendation about quarterly. And so, we really plan to follow up with them even more. It would be interesting to see a year down the line, 2 years down the line, 5 years down the line, how are they doing? And so, it's really that, when I looked at all the data together collectively, because I was just trying to see, can I see a pattern? Can I see, things that will inform our practice and improve our programming? And so, when I was looking at my data I have in front of me, behavioral health was pretty much the #1 category that we noticed a huge improvement on. And so from, the beginning to the end, which is 3 months, we've seen pretty much an average of like 25 to 30% improvement, since they came in. And so, and I was looking at, the definitions of behavioral health, and it actually encompasses a lot. And so it includes mental health, emotional health, if they have issues with substance abuse, those are all included. And so also looking at coping strategies, whether it's healthy or unhealthy coping strategies. And it really made sense to us because with our survivors that come in, they are really on this journey. When they come in, they have to be stable, they have to be out of crisis, and we have some minimal requirements so that they're ready to they're job ready, and of course, you don't have to be perfect, but there needs to be some level where they can start, right? And so behavioral health, that's something that we really work on, especially with occupational therapy. When we embed it into the academy courses, we make sure that, a lot of women come in with anxiety, they come in with all these different issues where, it's not so much the technical skills. Like our women are bright. They come in, they can learn job skills, they can learn all these different technical things, but the social emotional piece, those skills are really affected because of the trauma that they've experienced. And so that's what we really focus on with occupational therapy. And so during the academy, they're really learning all the different skills that you need at work and things like that. In occupational therapy, we really reinforce that, and we help them apply that in more of like a, it's kind of like the lecture phase and then the lab phase, where we really make sure they're really learning. And so that's something, the behavioral health category that we've seen a big jump in, and we feel like it's such a reinforcement, to our program. And, although the education and employment categories, we haven't seen such a big jump, I was like, okay, why isn't that the case when we are a career development, and we are also a wellness, organization but I realize it's also because our ladies are coming in and wanting to develop their careers and their job skills and things like that. However, in the 3 months, you really can't see the needle move that far, because either they're going to school at the time or they are just exploring with their career, like what they want to do. So within those 3 months, the categories can't jump because they didn't get a job yet. Right. So it makes sense. So then it made me realize, okay, with this tool, although we may not see such a big jump in those categories, a year later, 2 years later, we'll reassess, and I'm pretty sure we will see that. And so that's been a really nice part of the tool, where it's really giving us insight and giving us some direction in how to continue our programming, and how we can pivot, or how we can be more effective in capturing the outcomes.
All right, thank you. So I do want to ask a few more questions, but I'd like to launch this other survey just to see where the audience is at on the OHTS tool within their own line of work. Are you guys hoping to adopt it? So you should be seeing this on your screen now, and it's very helpful, somewhat helpful, or it unfortunately does not apply to their line of work. A lot of people want to implement it or talk to their supervisor to see if they can implement it. And we do have 10 responses saying that they want San Diego to start a collaborative that works with OHTS. So what do you guys recommend for us to start doing this collaborative? What should be the first step? Sounds like you guys had a retreat. I think we'd get even more buy-in if we had a retreat.
I don't know who should answer that. I just know how we started. Esther shared a bunch of resources with us so that we could become familiar with the tool, all the PDFs that have been shared in the chat already. Just have people, honestly, you have to read through it a few times to really kind of wrap your head around what this is and immerse yourself into it. And then just start seeking like-minded. If you don't have a foundation grant to work from, just seek like-minded organizations that would say, yeah, we would love some kind of a tool to standardize and collaborate, and we would be happy to walk them through the process that we went through. And I would love for Jamie and Esther or even Stacey, whoever wants to respond.
All right, Jamie raised her hand, so let's go with her first.
I'm going to sort of speak because I feel like I was the outsider coming in, and so sort of like my observations with it. There's a lot of storming that happened among the 4 collaboratives before this ever came together. So, it's sort of, it wasn't an immediate, yeah, let's do this, adopt it, let's go. It was a really critical process, which I sort of loved being a part of, because everybody really got to voice things like, we're stressed out, we're maxed out, we don't have time for this is not in our capacity right now, and really breaking it down as to, well, what's in your capacity? How do we take really small strategic baby steps where we digest the tool, and let's set up some more training? Where do you feel like the barriers are for wanting to implement it? So I loved that about the 4 organizations, because it really was a critical process. And also questioning, is this really going to add value? Are we going to be able to protect our survivors, especially around confidentiality? Do we have the capacity to keep data private, etc.? So I guess it's the first step to take is storm it out. Does it actually even really make sense for your collaborative? And the beautiful thing of watching Elevate Ministries together are how complementary they are, because two really provide a lot of like long-term assistance from, you know, that immediate street contact that Brian was talking about, all the way to mentorship programs and qualified, where we're really trying to work on, you know, thriving in a career. And so that's been really fun watching how they all complement each other within this tool, because there are so many categories. Because there are things Esther's not going to assess at all, because it's not pertinent for where that survivor is at in their particular journey, while treasurers might in their mentoring program. So that's just sort of my viewpoint of watching you guys in your journey. So I'll pass it over to Esther.
No, I think you guys pretty much said it, what I was thinking as well.
I will say too, 100% I agree, Jamie. People don't need more stuff to do, but if you can frame it in such a way that, like, look, I know you're already doing so much. This is a layer you can add of what you're already doing that will only enhance your own reporting and your own data and understanding of your clients. But it's also maybe the key to unlocking a lot more funding, which if you've worked in nonprofit, which I have all my life, that's like a key, like, oh, I might be able to have access or venue to kind of basically tout what we're doing and have actual data instead of just anecdotal evidence. That's huge, and they will jump at that if it can fund them for more years. So it is a motivator.
Yes, definitely. And it is where the government is headed. Who knows how long it'll take them to start requiring it across different states and also different organizations, but it's where it's headed. So if you can get a jump start on this, you're more likely to be able to benefit off of the resources that are going to request it. All right. I do want to ask, I know Stacey is not technically part of the panel, but how many other collaboratives have reached out to you that have adopted this tool?
I don't know exactly. What I can tell you is that we track user download, just, which sounds creepy, it's not. Just like mostly I'm able to see the number of unique downloads, and I think we're well over 1,000 at this point. But that's just folks who are coming directly to RTS website. I mean, I know, for example, I'm just going to choose you, Jamie. Maybe you go in, or maybe Esther, right? Esther gets it and then she shares it with her 3 other organizations via attachment. So we don't really have a way that we know or are tracking beyond that. But I do know, for example, just even in California alone, they just required their 30 grantees to use it. And none of those came to me to get it. I mean, they got it from California state agencies. So it's impossible to really know, but it is really exciting just to see the enthusiasm around evidence-based service provision for survivors, and just the volume of emails I get on a monthly basis from agencies and organizations who want to learn more. And you know, while I'm speaking, I just really want to take a moment to give a huge shout out to you, Brian, and Esther and Jamie, for the work that you're doing. I think it takes, I think you're visionary, you know, and you just sort of mentioned that, and kind of seeing or anticipating where the field is going, where the climate, you know, the federal funding climate is heading. And it is absolutely going towards outcomes. We are really among fields in the behavioral health arena lagging behind every single one of them. And it is only a matter of time before it is required, which hopefully we can see as a good thing and embrace as a good thing. I do think that measuring outcomes, if done well, can really improve our service provision, and that's the goal. And so just a huge shout out to you for your commitment, your investment. You know, sort of the question that you were just talking about, that it does take being able to maybe have that long vision. Like, yes, we're swamped. Everybody's swamped right now. Are you really going to ask me to do one more thing? But to be able to see or anticipate or have some kind of confidence in that return on investment, which I don't like using business speak language, but really just that the investment in time and resources in terms of helping improve people's lives, helping build out your program, helping increase funding that you can bring to your program, you know. So again, I just think y'all are incredible. You're doing really, really powerful, impactful work, and I just wanted to say that in front of this group of people here. And I'm sure the rest of you are too. I just know that I've had the opportunity and honor to speak separately with Brian, Jamie, and Esther.
Thank you. Thank you all. And yeah, just so you guys know, this collaborative is very much in touch with Stacey and Samantha, and it is important to reach out to them because this, like, informing them that you are using this tool is really going to help them see the bigger picture and what is working. And if it does need to get modified, they'll be able to do it. So we will definitely be, you can already see on the HT Radar website, the contact information for everyone here. They all accepted that. So it will also be included in the follow-up email. I do want to open it up now for the audience. Kathy, you've been so patient. Please go ahead.
I have a question because we're using the form for one program that I'm working with, and that includes clients from another sector, that because I do educational groups all over the county of San Diego, and I want to know how it would affect if I wanted the smaller program to start using this, so they can show how well their program works. And then I'm already reporting their people through the people that pay me to do. Okay, I don't want to use names, but it's North County Lifeline that's paying me to do this stuff. And it's Alabaster Jar, that's a smaller program. If we could show how well they work and stuff, how does that impact if you report the same people, you know, because it's their people and their people will all be into one. Does that, am I making sense?
I lost you a little bit. Is it clients that you're talking about?
Yes. The clients that I do educational groups with at Alabaster Jar, I'm already reporting them to North County Lifeline, but I want Alabaster Jar Project to start using this to show how impactful they are for themselves, and maybe use it for future funding.
So are you asking about, this may not be it, but this question has come up before, I'm sort of inferring it. Is it the case that you are sort of in a situation where you have a client and more than one agency or organization is serving that client, and you would like to get all of the data in the same file about that client, but it would require more than one adult who's not the, more than one case manager completing the data in the same form? Is that what you're asking about?
Well, okay, what I'm asking about is I'm not a case manager. I'm just a facilitator of different groups. And I report on the people that I teach at Alabaster Jar, okay, to North County Lifeline. Now, if I wanted to get Alabaster Jar to start using this format on their own people to show how well they're doing and to educate them on how they could show funders how well their program works, because they have very little recidivism and stuff. How is that going to impact them reporting their own people, and then I'm reporting their people to another program? Does that make sense? They all have the same ID number, you know. I mean, each individual has their own unique identifier.
Right. And do those organizations share that unique identifier?
Yeah.
Okay. I think the answer here is key, correct? The software that is used in Excel so that multiple users can have access to the same file. Stacey would be the one to.
So yeah, multiple users can have access to the same file if, but you would have to figure out data sharing agreements. You would have to create data sharing agreements so that more than one person could access that file. and to share the data in a secure way. For example, we would advise that people not email the Excel file as an attachment, but rather create a secure file upload, like an FTP site, where the data can be uploaded behind a firewall, and then someone else can go into that same file and complete the data also. Does that answer your question or not? I'm not sure. I'm still not sure. I'm getting it.
Because
I apologize.
would they need to do totally separate evaluations, or can they share the same evaluation result?
There would be two totally different evaluations.
Okay.
These folks over here I'm thinking I want to encourage them to use this, because watching this has educated me about how it's used. I mean, before I was just filling it out. This really showed me the impact that it can make, which I want to try and get one organization to use it independently on their own, to educate themselves about what they're doing and where they need to improve, or what areas the clients need to improve, versus me just reporting stuff to this other agency. Does that make sense?
Yes. Well,
yeah, that's right, Carly. That's exactly what I was about to say. Do you want to jump in with your comment, Carly?
Dr.
Carly
Carly.
I don't
Yes,
think there'll be an issue
I
unless
can,
both
I
are
can, I can say something. Kathy, I don't think it matters as long as they're not under the same funder, because what the tool is trying to do is to really measure the outcomes of the program. So in this case, let's just call them organization A. Is trying to address some of the survivors' needs and rehabilitation processes that need to happen for them to be reintegrated into society. And then the other organization may use the same information for something else. It sounds like they're paying you to do some training throughout the county. And as long as that data, I mean, I think that the issue would be if these two data sets come together and they're not matching, like non-for-profit A has a different identification for the same person, and then we collapse those two data sets, then that I can see there will be an issue there. But if the same person is the same person in data set 1 and data set 2, then there's not an issue if in the future for somehow these two data sets come together, because then you're able to identify as like, oh, this is, Anna Smith, and this is also Anna Smith on these two different data sets. So you know this is the same person. So I don't think, from what I understand you're asking, I don't think that would be an issue. Does that make sense?
Yes, because agency A has like 7 different sub grants that are reporting to it. And my people that I report on is not one of those 7.
Exactly.
So if they want to use it independently, okay, I got you.
Yeah.
Okay, thank you.
Theoretically, though, I will say this, like, theoretically, like, that would be an interesting study, because the whole point is that we should have reliability. Like, people, I mean, in an ideal circumstance, right, the tool itself is functioning so well that you, Kathy, are going to be scoring your person on education, and your scores will be identical to the way this case manager at the other agency is scoring the same individual, because the tool is reliable and valid. And that is precisely what we set out to do with the tool. Now, I will say that, like, it just requires ongoing work to make, ongoing studies with different populations in different settings to ensure, in fact, that that is the case. And if it's not, to continue to improve upon it. And so, you know, again, I just, that's the goal and that's the hope, but hopefully the scores should theoretically be very similar, like they should be identical actually, so.
And when is this Zoom meeting be available for me to get them to look at it?
Yes, next week. Next week is what we're shooting for. Yeah, by Christmas.
Oh, Merry Christmas. Thank you.
Any other questions? Well, anything that one of the speakers would like to address and that we haven't covered before? Wow, looks like we've wrapped up. Well, thank you so much. I really, really do appreciate having all of you guys here. I think this is the biggest group of speakers that we've had at H2 Radar, but it was very seamless, and thank you for all of your expertise and yeah, your time, and also your willingness to letting us record you so that we can share this more, and just completely collaborative in sharing your information and letting our audience reach out to you so that we can follow in your steps. Esther, yes.
I actually just have a question for the audience. I just wanted to see really quickly, maybe just take a little poll of what kind of outcome measures everyone else has been using besides the OHTS. I'm just curious.
Either speak up or you can put it in the chat. We'll keep an eye out. Unfortunately, I can't make a poll that has a fill in the blank. Does anyone use I know that at the beginning of the meeting, there were people who used outcomes, tracked outcomes, but are any of those people still here?
I've been doing anti-trafficking work for 21 years now, and I'm a survivor, and I'm a researcher. And so I appreciate how you have pulled everything together in a relatively simple way to be able to track this for people who may not understand research. So I really appreciate how this whole training has gone.
That was the goal. That was the goal. I really, really appreciate that feedback and your enthusiasm. I just honor all the work you're doing and all the perspectives you bring to bear. Thank you.
All right, it seems like the people who are tracking outcomes are no longer here. But yeah, I will be sharing the polls with our speakers just so that they get the numbers of like what this audience was thinking and how it affected their decision making on like, yes, I want to use OHTS or not. Thank you everybody for joining us. Like I said, I'm super excited about this tool, and I do think it is a work of art in a scientific way. But thank you for everyone joining us and also the work that you do. Please do enjoy the holidays and look out for the email with questions and answers, and also the recording next week.
Thank you, Luz.
Thanks, everybody. Bye.